In a bold move that has sparked nationwide debate, Minnesota has taken a decisive step away from federal health guidelines by allowing pharmacists to administer COVID-19 vaccines to a broader population than the Food and Drug Administration, FDA, recommends. This unprecedented action, spearheaded by State Epidemiologist Dr. Ruth Lynfield, has ignited discussions about public health autonomy, vaccine safety, and the growing divide between state and federal health policies. But here's where it gets controversial. While Minnesota argues this expansion is about accessibility and protection, critics question whether it prioritizes convenience over scientific caution. Let's unpack what's at stake and why this decision could redefine how we approach vaccines for years to come. The state's new standing order grants Minnesota pharmacists the authority to vaccinate anyone aged 12 and older without a prescription, a stark contrast to the FDA's current criteria, which limits this access to individuals 65 and older or those with pre-existing health conditions. For children aged 3 to 11, the policy also permits pharmacists to administer pediatric versions of the vaccine upon parental request. Lynfield emphasized that the goal was to remove barriers to vaccination, particularly as public interest in the shots has waned since the pandemic's peak. "We wanted to make it easy for Minnesotans to go to a pharmacy," she stated, noting that nearly half of all COVID-19 vaccinations in the state already occur at pharmacies. This shift marks a dramatic departure from Minnesota's historical alignment with federal health agencies like the CDC and FDA. The change follows a seismic reshuffling of federal health leadership, including the appointment of vaccine skeptic Robert F. Kennedy Jr. as Health Secretary, and the subsequent overhaul of the CDC's Advisory Committee on Immunization Practices, ACIP. Last week, the ACIP, now led by Kennedy's allies, rejected broad recommendations for the vaccine, urging individuals to make their own medical decisions instead. This has left states like Minnesota to chart their own paths, even as national medical organizations, including those representing pediatricians and family doctors, continue to endorse unrestricted access for children 6 months and older. Proponents argue that Minnesota's move is rooted in data. Recent studies, including one by the Bloomington-based Health Partners, show vaccines are 33% effective at preventing emergency room visits for adults and over 40% effective at preventing hospitalizations for seniors. Meanwhile, hospitalizations and deaths from COVID-19, now an endemic disease, remain a concern, with over 3,500 hospitalizations and 320 deaths recorded this year alone. Yet skeptics raise valid questions. Are the risks of widespread vaccination, however rare, being adequately communicated? For example, a University of Minnesota-led review found up to 3 cases of myocarditis per 100,000 recipients, primarily in males receiving the Pfizer vaccine. While these cases are mild and rare, they highlight the need for transparency. The debate isn't confined to Minnesota. Wisconsin's state epidemiologist recently issued a similar standing order, signaling a broader trend of states taking charge of vaccine policy. Governor Tim Walz cited concerns that federal health authorities are ignoring scientific evidence as a key reason for the state's actions. However, critics like Dr. Gregory Poland of the Mayo Clinic, who himself experienced a rare side effect, tinnitus, after vaccination, warn that diverging from federal guidance could erode public trust. The ACIP we knew has been hijacked and is today an ideological body, lamented Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy. Referring to the panel's recent politicization, "So, what's next?" As Minnesota and others push forward with their expanded vaccine access, the nation watches closely. Is this the right approach to balancing public health needs with scientific rigor? Or does it risk undermining the credibility of medical institutions? Share your thoughts in the comments. Do you support state-level vaccine policies that defy federal recommendations? Or do you believe centralized guidelines should take precedence? The conversation is far from over, and the answers may shape how we navigate future health crises.